Acting White House Chief of Staff Mick Mulvaney insisting the debate over pre-existing conditions is over. You heard that. But the debate over health care reform is far from over. We are joined by Arkansas Republican Congressman Bruce Westerman, who recently introduced a piece of legislation called the Fair Care Act. It's been gaining a lot of traction in light of the president's recent comments. Can you break it down for us? I know it doesn't do away entirely with Obamacare.
Oh, good to be with you, Melissa, and you're exactly right. We were looking at solutions to the healthcare problems facing our country, and we didn't necessarily look at it as if it's a Republican idea or a Democratic idea, but what's a good idea. So it had to cover pre-existing conditions, it had to lower cost, and it had to give consumers more choices and options, and I think we have that in the Fair Care Act.
How'd you do that? I mean, how do you achieve that?
Well, we just looked at the individual components. We've been working on this for over a year and a half and worked with CBO on individual ideas to see if it would cover more or less or cost more or less. And I think we've got a really good plan. You know, if you look at what's happened in healthcare over the past 10 years, the cost of Medicaid's gone up 75%. The cost of prescription drugs has gone up 42%.
Okay, so
consumers are paying a lot more.
Do you control what it is the government is going to pay for Medicare or pay for drugs for people who are on Medicare?
No, you introduce more generics into the mix. You make it easier for generic drugs to get in. We used a bill that Senator Leahy had, and we tried to improve on that. So that's a bipartisan issue on how to address prescription drug costs. We also looked at bills that had passed in the House with big bipartisan support. You know, the Affordable Care Act allowed the insurance companies to create monopolies. We passed a bill with 416 votes last Congress in the House to put those antitrust laws back in place. So we've got that.
Where do you find, because there's a big
plans.
hurdle in terms of cost if you're going to lower the price for people. So did you send more control back to the states? Did you focus the federal money on the risk pools, on people with high costs and pre-existing conditions? I mean, how did you move the money around in order to pay for this without costs going through the roof for consumers?
Yeah, and one of the big things that the Affordable Care Act did, the increased cost, was on the way that we dealt with making sure everybody could have access to insurance. With the high-risk pools, we allow insurance companies to capture the 10% of their population, put them in the risk pool. The consumer knows no difference. They go buy their insurance. They're not discriminated against based on pre-existing conditions. But 10% or so of the insured population accounts for about 80 to 90% of the cost. So we capture those costs, capture the risk, and it allows others to buy much lower cost insurance policies. So This is a good idea that was there before the Affordable Care Act came along.
How much support does it have, and has the CBO looked at the math to see if it works, or anyone?
It hasn't been scored yet. Like I said, we worked with CBO on individual components, and I think it can gain widespread support. Everyone I've talked to about it so far seems to think it's a good idea and wants to look at it more. You know, we put this out before the president came out with the latest ideas on what's going to happen in health care, so I'm glad that we had it out there.
Did he respond to this? I'm sorry, I don't mean to rush you, but we're running out of time, and I'm very interested in what you have. Have you shown this to the president?
I've talked to people on his staff. I hope to be able to sit down with the president and go over it. But again, it's a lot of good ideas, and we're open to feedback and suggestions on how to make it even better.
All right, Congressman, thank you.
Yeah, thank you.